In a world where comfort and dignity in healthcare are often overlooked, have you ever considered the profound impact of what you wear during medical procedures? This episode explores how innovation and empathy converge to create garments that respect and enhance patient dignity, offering practical solutions for medical access.
Welcome to Healthtech Growth, the weekly podcast for healthcare founders and innovators, where we explore essential strategies to create successful and sustainable healthcare startups that improve patient outcomes and transform the healthcare industry.
Hi, I'm Chloe Kelsch, Vision Catalyst and CMO of Pulse Point Path. Today, we're diving into the transformative world of healthcare innovation with HeartSnug, a medical chest coverage garment that's revolutionizing patient care by enhancing dignity and accessibility in women's healthcare. Join us as we explore HeartSnug and how Lauren Orlick, CEO and founder, is making a difference in this episode.
The word empowerment has been thrown around a lot, but if you really look at empowerment within, the medical garments and being naked in front of doctors, we sign our waivers, when we first start our, relationship with our doctor, new doctor. But we walk into medical settings and already give up so much vulnerability. And it's not even about empowerment because we weren't given the power. I'm a single mom of twins, and I tell them, if you ever feel uncomfortable being naked with someone or someone makes you feel uncomfortable, you have the right to, and with respect, you have the right to take a second. And listen, when we designed it, we did a year-long study and statistic talking to large medical hospitals, providers, health insurance companies, government, patients, and expert leaders. And we found that, yes, there's nothing like it that exists. Yes, it's going to be near impossible to break into hospitals, which we are starting, but not everyone is going to have the vulnerabilities or sensitivities around being naked at the doctor. Sometimes you go to a doctor and we don't care, but it should be the patient's choice. It shouldn't be the provider's choice. And so, us women, we're 51% of the population right now. There's a lot being done in femtech and fem movement around, considering women patients, those that their bodies are changing. And so we really, during the impact in our study and surveys and data, really it came to light from teen to geriatric care. There is not a one size that fits all. And we talk about the evolution of medicine, the evolution of facilities, doctors, procedures, take-home tests, but there's no evolution since HeartSnug that's been provided until now. And it is such an easy solution now, laying on an MRI machine where women's breasts just hang to the side, to be able to have that level of comfort with HeartSnug instead of just in a gown. It's really about education, awareness. And since we've been able to really launch it out into the public the last few months, and especially the last couple of weeks, it's really been about showing its value add, and people, once they have it, they see it, they're using it, they see it. And so that has been wonderful to see it progress down the supply chain, the value add within large hospitals and getting approved. I think just the consistent revenue is just, like we said, we're trying to create a movement here. We're not wanting to sell, one or two. It's really moving and making really large impact with large hospitals, clinics, providers, private companies, government, you name it. We're really trying to hit it all to really build up that current revenue stream. But right now, it's really been about education and awareness and introducing HeartSnug around patient satisfaction, patient survey, really putting that at a forefront. I think that with HeartSnug, we are hearing and seeing not only women, but men in the healthcare industry really, under this femtech movement, this $1.3 trillion industry that, that there has been so much movement on so many other levels around, modern medicine and technologies. And the 100-year-old one size fits all gown is not enough. And, our struggles are our struggles right now, but hopefully will not be our struggles if you talk to me in a month. I mean, the way that things are building and progressing, and be able to share our message and passion that, yes, if we had a lot more money, we could probably roll this out a lot faster and or target, more people. But we've just been really careful with the build and creation of what we've done so far. We are extremely proud. I want everyone to feel my passion. And I know I can't expect that, but there's basic human rights, whether what side of whatever you're on, whether whatever religion, whether who you love, what you wear. Women, patients, we wear bras the majority of the day. It's to hold us up and make us feel more comfortable. Menopause is the hottest vertical right now within healthcare. Let's stop. Let's think about what menopause can do. Heat. We can provide more breathability in the breathable fabric. We can provide our patients something other than the robe or the gown. Come on now. We know more now. Let's do more now.
Scaling any business comes with challenges. So we asked Lauren Orlick of HeartSnug what her barriers to success are right now, and if she had a magic wand and could change anything around, what 3 things would she change right now? So her answers were education and awareness around her brand and the product, not having enough funds to engage with a big brand or marketing agency, and really needing to create effective messaging for multiple audiences. So to jump right in, I would like to first address the lack of funding for large branding efforts. So many startups face challenges in branding development due to limited funds for big name branding agencies. So to overcome this, consider partnering with a prestigious university offering marketing programs. Exchange your business for intern and graduate level projects. This way, you're leveraging the expertise of a seasoned professor who usually acts in a creative director capacity. And I will say this, professors at big universities, a lot of times even small colleges and universities in marketing programs, are usually also seasoned marketing professionals themselves. So you get that talent and the expertise, the years of experience of the professor and a marketing professional. And you also get the fresh perspective of students. And really think about this as you're getting the best of both worlds, because you are getting that age and experience and industry know-how, but you're also getting the freshest minds of the next generation of marketing professionals. So you're sure to get a lot of really great out-of-the-box creative solutions when it comes to your brand and messaging, which is so important to your growth and scalability. Alternately, you can explore partnerships with smaller agencies, with freelancers, and with any organizations, entrepreneurs that are fractional CMOs or creative directors, think tanks, masterminds, accelerators. These are all great examples of organizations that might offer fractional brand and marketing executives. So these are very cost-effective and nimble solutions for startups. And it looks like HeartSnug is on the right track by having already engaged with a local university. So stick to it, and I'm sure that you will see great returns and great rewards. Next, enhancing education and awareness. Education and awareness around any new product, even products that have been on the shelf for 20 years. These are crucial for effective brand positioning across diverse audience segments. So HeartSnug targets multiple audiences. They target B2B for entities like hospitals and insurance companies, also B2B for disorder and disease advocacy and research foundations like the Cancer Research Foundation. And they're also wanting to go direct to consumer. So that's a very direct to approach, or a DTC approach. Crafting a compelling, unique selling proposition, or USP, that resonates with all of these target audiences is essential. Align your messaging with the core mission, values, impact, and you want to be addressing the specific pain points and evoking action and emotion. So for example, revise your homepage to clearly articulate the problem you solve and the unique benefits of your product, ensuring clarity and impact. So delving now into the optimizing positioning across multiple audiences, this requires clear and impactful messaging strategy. So HeartSnug must articulate, again, their USP that addresses a commonality among all of these target audiences while also tailoring messaging to resonate deeply within each segment. So emphasize the revolutionary nature of your product. Highlight its unique features, such as being X-ray safe, mammography safe, surgery safe. If you would also like to add in the environmental safe factors, like being California 65 certified, that is going to speak to another audience. So communicate your mission to eradicate vulnerability and lack of comfort as well in women's medical journeys, emphasizing equity and accessibility for all. And you don't necessarily need to say this with the words, our product represents accessibility and equity for all. This can be told in just as a vulnerable way as the women's medical journey is. It can be told by the women themselves. And I often like to tell people, say it without saying it. Like, show what it is you're advocating for. Show by either showing the solution or by actually talking about the emotions and talking about the journey. That's going to tell the story of equity. That's going to tell the story of accessibility. When you hear from both patients and providers on how it creates a safe space, a feeling of comfort, how it minimizes the vulnerability in an already vulnerable situation. And then for the doctor's side, how easy it is for accessibility during examinations or surgical procedures or treatment or testing. So that will tell your story itself. Finally, ensure consistency and clarity in your brand messaging to build authenticity and trust. When you build trust with your audience in an authentic way, you build lifetime partnerships and lifetime relationships. And then you start to evoke action. And then when you deliver on that product and it's successful, it keeps the promises that you said you wanted to keep in the beginning, then you create advocacy. That is the power of branding, development, and marketing, having the right message, being able to tell the right story in the right place to the right people. Can't wait to get into more and see where HeartSnug goes. I love this product. I love what they're doing, and really looking forward to our next opportunity to interview them again, see where they grow to. Thank you so much. Looking forward to next time.
Thank you for listening to Healthtech Growth. If you're a healthcare tech innovator or founder interested in being a featured guest on our show, visit healthtechgrowth.io to learn more.